I'm Amanda Leary. I am the Registered Locality Manager for our brand new services in Derbyshire at Swadlincote and Ilkeston. Back when I was born, I had a great aunt called Lily May, and she was my inspiration. She had a learning disability and she lived in a long stay hospital in the north of Derbyshire. Every week, my mum and my grandma used to put me on a bus in a pram and take me off to meet with Lily May. And Lily May thought I was her baby, so she would very often steal me in the pram and run off around the grounds of the hospital, and we'd have nurses running around chasing, trying to find me. She was one of the most beautiful women I've ever met in my life. She wasn't particularly tall. She had white hair. She had the clearest skin, piercing blue eyes. Her sense of fun was just phenomenal. She'd always be lifting her skirts up and doing a little jig. And Lily May just wanted to please people. She wanted to be around people. She wanted to live life. And she'd lived in the hospital for 40 years. She went in as a young teenager. And in the very early 80s, the government brought out a white paper that said that people should no longer live in long stay hospitals and should live in the community. And I'd already started to pursue a career because of Lily May, because I wanted to make things different. And Lily May was assessed for moving out into the community, and she was so excited, and we were excited for her. So she was moved from a ward style setting into a smaller setting to prepare her for the move. So she was living with 6 other people in this smaller unit. She was learning to cook, she was learning to clean, look after her own home. She was going out shopping with the staff. So we went one day and she'd bought pink curtains, pink bedding, pink cushions, pink, everything was going to be pink. The carpet, the walls, the doors, everything. And all of Lily May's life, she'd never had anything of her own. She'd always had to just share what was ever on the ward. She shared bathrooms, she shared everything. She had no choice, she had no control over anything. And I knew that was wrong from a very early age, that everybody deserves to have choice and control in their life. But what happened to Lily May was she was going to be moving into this new core house, as they were called back then, run by the NHS, but in the community. And one day we were called into the office. We went to see her and was called into the office. And we thought, oh gosh, what's Lily May done? Because she could be quite mischievous and she could steal things and she could be a little bit challenging at times. And we thought she's done something that will prevent her from moving. But what they told us was far more devastating than that. And they told us that Lily May had breast cancer, and that they wasn't going to do anything, and they put it down to her having a learning disability, that they wouldn't do anything. And that really struck home to me. That was that's so wrong. It doesn't matter, she deserves to have the treatment, but they wouldn't give her anything. We were fortunate with Lily May that she didn't experience pain, so you could see the lump, it was getting bigger and bigger. And 6 weeks before she was due to move into the core home, Lily May passed away. So she gave me my inspiration that I needed, because I wanted to make sure that nobody lived in those kind of conditions again, but equally had the right to healthcare and had the right to treatment if they needed it. So that's kind of my story, Lily May, 40 years. Yeah, so December the 20th, 1982, I started my career in the adult health and social care sector. I haven't looked back on one single day of that. Started off as a care assistant, support worker, service lead, senior, service manager, and now registered locality manager. So I joined Real Life Options in January of 2022, predominantly to lead these 2 services, so Swadlincote and Ilkeston. I was really fortunate when I came on board because the buildings weren't built, so I got a really good insight on how these buildings run, how these buildings function. I've had the greatest opportunity to be able to meet every single person that is going to come and live in these 2 services. So I've assessed every single person. But that's not been just me working on my own. I've had the support of my own manager, Julia. I've had the support of Viv, Paul. We've been part of a project team, so we've met weekly. So we've discussed progress of the services, what needs to happen. We've been working in partnership with our own HR team, onboarding, recruitment, training, marketing, finance. Everybody within Real Life Options has really played a part in my kind of career within Real Life Options. I've had lots and lots of support. It's been absolutely phenomenal. Training wise, absolutely exceptional, the training that we've had. But yeah, it's been brilliant.